Welcome to my channel. My name is Lynn, and in today's video I will be doing just a a little over 2 week update of my plastic surgery journey. So to jump right in, I had a lipectomy done on September the 21st. That is where they go in and they actually cut to remove excess fat that you have, and I had liposuction done. Now the liposuction was done to my stomach, right on my flanks, and right in on the sides of my bra line. So the lipectomy part, which is where they cut, I was cut pretty much from in a circle around here and up almost toward my back a little bit to remove that excess fat. So as of right now, I am doing okay. I've been pretty much not able to record because I've been strictly focused on pain management. This surgery kind of made me, I think it's the lipectomy part, the pain that I experienced from that so far made me reevaluate any additional surgeries. Now, you would think, being that I've had previous surgeries like the tummy tuck and the arm lift, that I would be a pro. Going into this, I thought this was going to be the easiest recovery that I've had. No, that was very much incorrect. The liposuction, when you're recovering from liposuction, it kind of burns as the muscles and everything is reconnecting back and getting acquainted with each other inside your body. There are little sharp pains here and there, but the lipectomy part, oh my goodness, that kind of took me out. Like, I really was focused on staying on top of my pain medication and just trying to recover, take medication that will help with swelling as best as possible. Now so far for this journey, the swelling part, I didn't have swelling to probably about, I would say maybe day 4 post-op. Day 1, I was like, I think my last video, I was like, oh my goodness, like no swelling, and my stomach was completely flat. I was so surprised day 1 of recovery. But the swelling has definitely increased, which I knew. I swell in my hands, in my feet, of course in my stomach. When I wake up first thing in the morning, my stomach is mostly flat, but as the days go on, the day goes on, my stomach begins to swell. So I saw my surgeon last week. He told me to continue to compress, and the swelling would definitely go down, and my stomach would be a lot flatter than what it currently is. But it's definitely flatter than my pre-op. So I'm going to also post my next video, which is going to contain my journey from my tummy tuck to what's going on now. But I wanted to update in this video how I'm feeling. I'm going to insert a couple of clips of how I felt on a couple of days because the pain was real. Okay, it's day 2 of my recovery. Day 1, I really didn't do anything but just rest. I walked around a little bit, but that's pretty much all I did. And I ate, I think I ate some of my vegetables, and I had a smoothie. So yes, today I took my shower, and I am feeling actually pretty good. The one thing I will definitely say about this surgery is that your lips get chapped super quickly, even with me drinking in water and everything, they just get chapped. So, but that's it pretty much I've noticed so far. Just from having the liposuction and the lipectomy, my voice is a little bit deeper than what it normally sounds like, but I'm just resting in bed. It feels so good to take a shower, and that's going to be it for check-in for today. Nothing's really going on, just resting, recovering, taking it easy. One thing, my post-op appointment is not scheduled to October, I think 3rd, but they want me to come, since I have drains, they want me to come in sooner next week. So as soon as the nurse calls me, I'm gonna go in and see if I can hopefully get these drains pulled out and see what my doctor's opinion of what I'm looking like so far is. But everything is going well so far. Okay, it is day 5 post-op. Days, I think I recorded day 2 previously. Days 3 and 4, I just took my medicine, walked around my house a little bit, but I didn't get out of bed too much. But a couple things I noticed that I definitely needed from my prep video. One would be a robe, super comfy robe. I did use the paper tape. Some of my tape came off, so what I did, I just used the sodium chloride, and then I taped back on top of my wounds for that. As far as medication, I'm still taking all of my medications that were prescribed. I am weaning myself off of the oxycodone day by day, and I'm taking the extra strength Tylenol for that, but I'm feeling good. Today was the first day that I was able to shower by myself. Previously I needed help with my showers, but I was able to shower by myself. I actually did my eyebrows today because I could not go another day without my eyebrows being filled in, and I tried to gel down my edges a bit so I could at least do that little part for myself. One thing I will mention that I did not know or experience in any of my previous surgeries is that my tongue is numb. So my surgery was on the 22nd, which was, I was looking at the calendar, which was last Friday. Today's Wednesday the 27th, and I think later on that afternoon or that Saturday, my tongue started to feel very numb, like throughout the day. It wasn't like all day, but it would feel numb throughout the day. But now, for the past, I would say since Sunday, my tongue has been numb. Like today, as I'm talking to you now, it's completely like numb. When I eat, I can still taste, I can feel it a little bit, like on my teeth, but my tongue is numb. So that is an experience that is new to me. And I think that's it so much for it so far, that I'm experiencing that's different this surgery go around. Just so you know, my surgery, I'm not sure if I said this in a previous recording, so I'm gonna say it now. As far as my surgery day, and when I arrived and when I got home, I arrived at the surgery center at 7 a.m. My procedure was supposed to start at 10. I think it started probably about 11:15. They brought me back. I think I got there about 7:15. I was a few minutes late. But around, I would say 8 a.m., they brought me back to pre-op, and they got me prepared. They took a pregnancy test, they inserted my IV, drawed a little blood just to check everything to make sure I was good to proceed with surgery, and took my blood pressure. I would say and the anesthesiologist came in and talked to me, so I would say from about 8 till about 10:30, that's when all those things were happening, because the surgeon came in, he drawed the markings that were needed, and that's kind of the last thing I remember. My mom was in the room with me, waiting, because all I had to do was literally walk across the hall to the OR, but I don't remember walking across the hall to the OR. The only thing I remember was waking up, and my anesthesiologist was the same person I had last year, and I was so happy to have him because he does a great job with putting me to sleep and waking me up. We have this relationship now. Unfortunately, he's retiring. He retired on this past Tuesday, so I'm so sad to hear that, because I'm like, who else is going to know me like you do? He knows that I have a low tolerance for pain. He even told me that. He said, we're going to monitor your blood pressure, that way we know when to increase your pain levels. And so I remember I woke up in the post-op recovery room, and I looked at the clock, and it was about 2:15, and I just heard people talking before I kind of realized what was going on. I did feel pain, like pain was worse than when I had the tummy tuck, and it was pain to where I was shivering, and I actually started crying. I was acting like a 5-year-old. I was talking to my mom, and I was talking to her crying, and the nurse was so caring. She was so patient with me. Like, she was a great, like I had a great recovery team. She was wiping my eyes, she was giving me crackers, and she talked with the anesthesiologist. I heard them saying we gave her this, that, and the other. What else can we give her? And so they gave me some more. The anesthesiologist, he came over and talked to me, and he was like, we're gonna get you under control, just give us a few minutes, it's gonna sink in. And he was right, it did. After that, I was okay. So I spent a little bit more time in recovery, just getting my bearings, and they helped me get dressed, and then I put me in a wheelchair, and they rolled me downstairs so I can come home. And I'm quite sure I was home by 3 o'clock. I live about 20 minutes from the surgery center, so I think I was home about 3 o'clock, maybe a little bit after. One thing that I will mention was that I was not able to get my oxycodone beforehand, like while I was in surgery. There was a issue with trying to find a pharmacy that had it. I don't know why there may be a shortage, but I just wanted to point that out. If you're about to have a plastic surgery procedure and you're prescribed oxycodone, you may have a hard time trying to find it. I think my mom and my cousin, they went to about 3 or 4 different pharmacies before they was able to find it. So just wanted to point that out. But I am feeling okay today, as you can see. The fact that I'm up, I'm not in bed, and I'm feeling pretty good. So it's later on in the day after I ate breakfast this morning, and as you can see, I am in the bed. So when I got up this morning, before I took my shower, I was changing my dressings and noticed that my incision, well, not the incision, but the opening where the tube is, the drain is on the right side, right in that little opening where the tube comes out of my body, it was blood around the circle. And I was like, what is happening here? I've never had this before. In my previous surgery, I don't know what's going on. So I'm thinking yesterday I did entirely too much. Because I don't know if the blood wasn't draining down into the tube correctly or what. I don't think I don't know, milk the tube is what they call it, a milk the drain. I think I only did it twice yesterday because I was just doing a lot. Yesterday I had to run to the store, then I had to do another errand, and I was walking around, so that may have been a little bit too much because my right side was hurting. So that may have caused it. I'm quite sure it's probably what possibly have caused it. So I was dealing with that, and I thought I was going to be able to get at least one of the drains out because it is at the limit to where it can be drained, where it can be pulled out. But with that, I'm going to have to keep it a little bit longer until my doctor's appointment, which is on Tuesday, and I'm just like kind of over it. So today's not a good day. I also was like, you know what? I don't think I'm even going to get a thigh lift now because I don't know. I've been having a little bit of pain here and there. I'm trying to wean myself off of the oxycodone and just take the extra strength Tylenol. But after I got a real check-in about how thigh lift recovery is, yeah, no, I don't think I'm gonna do that. I'm just like, I'm gonna try to, I don't know. I just gonna have to live with what I got because I cannot take a worse recovery than what I've experienced with the arm and thigh lift. That recovery was okay, but the pain that I felt when I had my gastric sleeve, oh no, I couldn't do that again. I'm happy that I've done all of these surgeries, but the thigh lift recovery, that one I'll probably be an inpatient for at least 3 days. Yeah, I don't know about that. I'm gonna have to put that one on pause because after today, yeah, I just can't do it. So today is not kind of a good day for me, but I'm gonna push on through. Just wanted to kind of highlight how I'm feeling, what's going on each day with my recovery. And my tongue is still numb. We're at day 7 and my tongue is literally still numb. Now, to kind of talk about what bothered me the most so far, and again, just a little over 2 weeks, was those drains. Oh my goodness, the drains are irritating when they get ready to, when you've had them for a couple days and they begin to pull. Now, for your drains, you cannot get them removed until your fluids are under 25 cc's. Sometimes and they have to be under 25 cc's for 48 straight hours before they remove them. Now, sometimes they'll remove one of your drains if it's under that 25 cc's for 2 straight days, and you just keep your other drain in, or how many drains you have until that you reach that 25 cc's goal. Now, for me, I was at, I think, around under 25 cc's. I would say probably, for me, it's always like right at that 7 to 8 day mark. Some people can get their drains out within days 3 or 4. For me, that's not the case. I made sure I didn't do too much walking around or moving around like I previously did with my previous tummy tuck journey, because I knew that would make me drain more, and I wanted to get those drains out. I was hoping within that 4-day mark, but it didn't happen that way. For me, I believe I got my drains out. Let me see, Friday. No, I got my drain out on day 10. That is a long time. They actually, my right drain could have came out at day 8. That was a Saturday, and of course they're closed. And my post-op appointment was on a Tuesday, but that Monday I called into the office. I said, hey, I'm under the 25 cc's. I'm pretty much, one side is at 10, the other side is at 15, and I cannot wait another day. I need these things out because they were very painful. They were starting to pull on the sides and irritating. So after I got my drains out, that relieved a lot of pain and pressure that I was feeling, you know, within that first week. But right now, after today, I'm actually doing okay. This is the first day where I got up and I've kind of tried to put myself together a little bit. I did my hair, put on just a little bit of makeup because I have to run out to the pharmacy, and I said, hey, I can't sit in this house with this bonnet on, with my eyebrows not done, another day. I have to get up and make myself look presentable for myself. So that's that part there, and I'm feeling okay. Like I said, now the pain is still very much real. It was so real that I had to take an additional week off from work because it's difficult for me to drive. I can't really drive right now. It's still hard to move around a little bit, but doing the best I can. So I'm trying to take, you know, little steps back so I can make sure I am back into where I can be mobile and move around a little bit more with ease. Now, I thought by this time I would be halfway back to normal, but it wasn't the case. So each person's journey is their own. I'm going to try to show you a little bit of what I look like now, and then that's going to do it for today's video. I will also make sure I come back and do some post-op maybe clips as my okay. So this is what I look like. I just have on a bodysuit. It does not really give me any much compression, but I wanted you to be able to see the real result. I'm going to pull my pants down a bit so you can see this kind of how I am looking here on the side, and if I pull my pants up, this is kind of what I look like so far. Thank you for watching my video. Please consider subscribing to my channel if you are on a plastic surgery or health and wellness journey. I've been on this journey for the past couple of years, and I would love to share my journey and review your journeys as well. Feel free to comment or ask any questions down below, and I'll be sure to respond.